Imagine a world with limitations of movement, vision, hearing, cognitive ability, constrained space, behavioral and comprehension difficulties, perception issues, and pain. Their world is often narrow, confined, and in most cases controlled for them. Under these conditions, limited sensory stimulation, residents will often withdraw and their quality of life is diminished. Naomi Fields said, "Why should we drag confused people into our reality when we should enter into theirs?" We live our lives through our senses. Each day we're bombarded by large amounts of information that floods our senses. As the senses filter this information, our brain helps to interpret it, and thus we're able to learn. The collective experiences of our senses helps to influence our physical, emotional, and psychological functioning, indeed, our very existence. Because of our senses, we learn and develop an understanding of our environment. For example, using our sense of touch, did you know that each 3/4 square inch patch of skin contains 13 yards of nerves, 9,000 nerve endings, 6 cold sensors, 36 heat sensors, 75 pressure sensors, and 600 pain sensors? The average person touches 300 surfaces every 30 minutes. Imagine a world where residents with cognitive challenges can control and interpret their environment. Being hugged by a million strands of lights. Being surrounded by visual and tactile stimuli. Hugging a vibrating column of bubbles as they rise through the water. An environment with soothing music, colored lights, and aromatherapy. A multisensory environment is a dedicated space or room that taps into pleasant memories, using the primary senses to induce calm and bring about feelings of well-being, or introduces new, pleasant associations and feelings. The MSE primarily utilizes the 5 senses: vision, hearing, smell, taste, and touch. It is choice-driven and demand-free while being safe and predictable. The optimal level of arousal is unique to each individual. It is their sensory diet. The MSE rooms are designed with 2 goals in mind: to promote intellectual activity and to encourage relaxation. This controlled environment is designed to improve the therapeutic relationship between the caregiver and the resident with dementia through active or passive interaction, increased independence in mealtime, affecting overall consumption, improved overall mood or psychological well-being, increase in activity level. Activities are matched to fit the perceived motivation and interest of the resident. Lowered blood pressure, decreased muscle tension. Finally, researchers have found at least one clear link between brain plasticity and healthy aging. They know that a rich, stimulating environment can enhance and maintain brain plasticity, even in old age and Alzheimer's disease patients. Studies show that regular social interaction, sensory environments, exercise, and a healthful diet, as well as cardiovascular exercise, can increase neurogenesis, neuron communication, and hippocampus-related learning, and can decrease levels of beta amyloid deposits. In sum, it is possible to enter into the world of residents with Alzheimer's disease, provided we find the right door. We must use each interaction as an opportunity to allow the resident with Alzheimer's disease to take us on a journey inside their reality.
The multisensory environment that we have here at the Bridge at MontEagle has been so important because being able to share all of the things that we have in this room have helped us to identify patients and bring patients in here who normally would not have had the opportunity to do this well. The multisensory environment started with autistic children. However, now in this environment, we've realized that if you bring them in and you allow them to have the freedom to choose which item is their item that they feel like they need and that sensory-wise for them, then that's where the success comes in initiating this program within the multisensory environment. The bubble tubes are two different kinds. The first kind has a color control pad, and the resident is able to touch what color they want on that pad, and that color will come up through the tubing. The second one is actually connected to music. The only thing the resident can interact with there is to turn it off and on, but the bubbles will come up and respond with the music. Both tubes, not only do you see the bubbles visually, but you can hear them, so you have an auditory input, and you have the tactile, because when you touch them you can feel the vibrations and the bubbles themselves coming up through the tubes. The chair is kind of a big, fluffy, lazy boy looking chair that does have a remote to help patients get up and down and move them around and get them in the right position. We have the chair. They can choose that chair to come in and relax in, but typically we use the chair with the netting that hangs from the ceiling. We take the netting and we surround the chair with that, which gives the resident or the opportunity to feel like they're kind of warmer and gathered in instead of having a feeling of being too open. The fiber optic lighting, we have 3 in the room. 2 change colors as they move through. They're very dynamic, so as they move they change different colors. 1 strand that we have are already colored strands, and it gets a little lighter and a little darker. The purpose of those is so that the residents can focus on them, but they also have a lot of weight. So not only do they have the color, which is the visual, but the weight itself provides some sensory input and helps them to gather themselves. The projector has different discs that attach to it so that you can project different things on the wall. We have an ocean scene, a forest scene. We have others that just have various colors. We use the projector to draw the attention of the resident, or that they're drawn to that, to project it sometimes on the floor, sometimes up lower on the wall, sometimes higher on the wall. The soundboard is an interesting piece because it fans light across the whole board. It can be used in combination with voicing. We have patients that actually become too loud or they're too quiet, and they can hold the microphone and it helps them to monitor their own voicing. So if you have a yeller, they can see that they're yelling, and if they're too quiet, they can actually monitor that. The soundboard can also be connected to music. So as the music plays in the beat of the music, so move the lights, which then provides that resident with 2 forms of sensory input. It can also be used with touch. And as the patient touches the soundboard itself, each color that they touch and move along with will actually light up the board.
Here at the Bridge at MontEagle, we are so privileged to have the first multisensory environment room in the company. Through this environment, we have enhanced the lives of our residents along with our stakeholders. Furthermore, we're excited to have the opportunity to conduct further research in all of these areas.
We've seen many different advancements with people who have cognitive deficits by using the multisensory environment, because we are able to adapt the environment to allow them to function and then carry that function over into the general population. One of the great things about a sensory diet is that the results are almost always immediate and they're cumulative. So by using this type of environment, we increase the brain's plasticity, therefore allowing the person to better function in situations that are stressful to them, to increase their attention span, to decrease sensory seeking behaviors, and to help them transition in situations that are otherwise very difficult for them.
Attention has always been a significant issue when caring for the cognitively impaired. Traditionally, we have focused on treating attention through the use of structured therapy tasks that require the resident to be able to attend to either an object or a person When using the multisensory room, we have noticed that residents have significantly improved their attention.
Good morning, sir.
Good morning, Debbie.
Can you please tell everyone what your name is?
Melvin Cashin.
Melvin, we are in this wonderful room. What do you think about this room?
It's great.
It's great. It is pretty neat, isn't it?
Yes, ma'am, it is.
When I asked you where you would like to be, what did you choose?
Right where I am,
Where is it that you are?
in this chair,
What does that chair make you feel like?
relaxed and comfortable.
What are you holding in your hands, Melvin?
Streamers. Pretty streamers. They change colors. They make me feel good.
They make you feel good. I'm glad. When do you think you might enjoy coming to this room? How might you be feeling?
How much?
How would you be feeling if you thought you needed to come in here?
I might be down.
You might be down.
When I come in here, it cheers me up.
Cheers you up. That's so cool, Melvin. I love hearing that from you. Can you tell me any other feelings you have when you come in this room?
I have a feeling of relaxation.
Okay. About how long do you think you would like to stay in this room, Melvin?
All day.
All day. Do you feel like you can come and ask someone from therapy to help you down here, or the nursing staff if you need to?
Yes, ma'am. They're good to me.
They're good. You're an easy man to be good to, Melvin. Any other, you chose this chair and these lights. Is there anything else in the room that might catch your eye?
The bubbles, I think it's very nice that the facility has made it possible for us to come and be here and view and be a part of it.
Serenity HealthCARE continues to conduct research in the areas of multisensory environments and Alzheimer's disease. Please visit us at serenityhealthcare.com for more information and updates.